Hello, my name's Cy. I'm a student nurse. I'm going to teach you about Abilify. Abilify is a antipsychotic medication. It's also a mood stabilizer. Some of its actions of how it works is it's to decrease manifestations seen in schizophrenia, also associated with the agitation seen in the schizophrenia. It's going to decrease manic episodes and agitation seen in the bipolar disorder patients. It's also going to decrease depression symptoms and emotional and behavioral symptoms that are associated with irritability. Some side effects seen with Abilify. Common ones are drowsiness, extrapyramidal reactions such as tremors, slurred speech, dystonia, anxiety, paranoia. Those would be considered extrapyramidal reactions. May see some constipation as a side effect, maybe some tardive dyskinesia. That's going to be involuntary movements such as blinking of the eyes, lip smacking, facial grimaces. Some other ones are restlessness. You may feel like you got to get up and move. Orthostatic hypotension. You want to be careful getting up from the laying down position to the seated position, seated to standing. Just move slow. Your blood pressure may drop. We don't want you passing out and fading and hurting yourself. Other more serious side effects of Abilify are suicidal thoughts, ideations, hypersensitivity reactions, neuroleptic malignant syndrome. This would be, symptoms of this will be high fever, muscle stiffness, that type of stuff. You want to let your doctor notify your healthcare provider if any of these symptoms occur. Some nutrition with Abilify. You want to avoid caffeine, especially from energy drinks, sodas, pops, colas, teas, coffees. Avoid alcohol altogether. Alcohol and other CNS depressants don't mix well. You want to notify your healthcare provider if you're taking over-the-counter vitamins, herbals, and make sure they're aware of any other prescription medicines you may be taking prior to taking Abilify. Some considerations related to diagnostic testing. We want to get a baseline of all these. We want to get a baseline CBC, complete blood count. And then we're going to continue to monitor this during the first couple months initially. What we're checking for there is we want to check to see if you got a low white blood cell count. We want to check to see if you got low neutrophils, or we don't want them to be dangerously low, especially the neutrophils and the white blood cells. We're also going to check a complete metabolic panel, a CMP. What we're looking for there is we're going to check your liver function, kidney function, and blood sugar there. We're also going to do a fasting glucose on you. Diabetes is one of the side effects, although rare. We want to monitor it and stay ahead of that. When we do the basic initial test on these, then we will continue to monitor them annually throughout, except the CBC. We'll do that one the first couple months, and then annually from there on. Some contraindications for Abilify. Ladies, notify your healthcare provider if you plan on becoming pregnant and or are pregnant. It does cross into the lactation. It can be excreted be excreted through the breast milk and pass to the child. Also, hypersensitivity is a contraindication of Abilify. Some extras within the or about Abilify. Don't just stop taking it just because you feel better. Speak with your healthcare provider. Continue to take your doses as you should. Don't double up or skip doses if you miss a dose. And it is not right on top of the next time you're supposed to be taking it, go ahead and take that dose when you realize you missed it, unless, like I said, it's that time for the next dose. That's pretty much it for Abilify. If you have any other questions, just let me know and I'll try my best to answer them. Thank you. Bye.